The EC clamp, however, is not easy. It can be challenging because constantly there may be secretions. The nasogastric tube is hindering the airtight mask. So learning how to do this is important, and this video explains how we have to do it. This video clip will describe the correct application of the EC clamp. The C clamp is performed by encircling the thumb and index finger around the rim of the mask. The E clamp is by placing the middle finger on the mentum, ring finger on the ramus, and the little finger on the angle of the mandible. All three fingers providing the E clamp must be flexed at all the interphalangeal joints. Nails of these three fingers should bite into the bony part of the ramus, thereby avoiding pressure on the soft tissue and the airway below it. Head tilt is provided by using the thenar eminence to push the forehead down, and chin lift is by extending the wrist. The elbow of the hand providing the EC clamp is supported on the resuscitation trolley, thereby the EC clamp is above the elbow. This helps you to provide the head tilt chin lift position without causing fatigue to the airway manager. The other hand is used to pump the bag. Effective clamp is when the chest rise is adequate and you don't hear the air leak sound around from the mask. The double EC clamp or two-handed EC technique is a two-rescuer approach used during bag valve mask ventilation to secure a leak-proof seal. It also minimizes air leak and maximizes chest rise. The rescuer 1, who's the airway manager, uses both hands to form an EC shape on both sides of the patient's face. The C clamp, the thumbs and the index finger of both hands press down uniformly along the edges of the mask to create an airtight seal. The E part of the clamp, the middle finger, the little fingers of both hands hook under the angle of the mandible to lift the patient's face into the mask rather than pushing the mask down on the face. Rescue 2 focuses on squeezing the bag to deliver breaths while monitoring chest rise. Remember, to lift the jaw, use a bucket handle grip to pull the jaw upward. Avoid compressing the soft tissue, and this can be brought about by ensuring that your E fingers are biting. Use your nails on the bony part of the jaw, not the pulp of your fingers.